Have you ever wondered why turmeric, a spice celebrated for its medicinal properties, can sometimes be a cause for concern? That's right, the golden-hued spice that's been lauded as a cure-all in recent years might not be the panacea we've all been led to believe. Turmeric, with its active ingredient curcumin, has been used for centuries in traditional medicine, touted for its anti-inflammatory and antioxidant properties. There's no denying the impressive resume of this vibrant spice. It's been linked to a plethora of health benefits, from boosting brain function and lowering the risk of heart disease, to even providing potential protection against cancer. However, like many things in life, it's not all sunshine and rainbows. Despite its wonderful health benefits, turmeric isn't a one-size-fits-all remedy. It's a powerful spice, and with great power comes great responsibility. It's crucial to understand that what works for one person may not work for another. In fact, for some individuals, the consumption of turmeric can be more harmful than helpful. So, where does the misunderstanding lie? Well, in the world of health and wellness, it's easy to get swept up by the latest superfood trend. As a result, the benefits of such foods are often exaggerated, while potential side effects are downplayed or ignored. This has been the case with turmeric. While it's true that it can do a lot of good, it's also true that it can cause issues for certain individuals with specific health conditions. In the end, it's not about demonizing turmeric, but rather about understanding and respecting its power. It's about acknowledging that while turmeric can be a valuable addition to many people's diets, it might not be the best choice for others. So, let's debunk some myths and delve into the science behind why turmeric can be harmful for certain health conditions, because knowledge, after all, is our greatest tool in making informed health decisions. It may surprise you to know that the very properties that make turmeric beneficial can also make it harmful. At the heart of turmeric's potential for both health and harm lies a compound known as curcumin. This vibrant yellow chemical, which gives turmeric its signature color, is a potent antioxidant and anti-inflammatory agent. It's this property that has made it a star in the world of natural remedies. However, as with many things in life, there's a flip side to this coin. Curcumin's anti-inflammatory properties can interfere with the body's natural inflammatory response. While this can be beneficial in controlling conditions like arthritis, it can pose a problem for people with immune disorders. In these individuals, the body's immune response is already compromised, and curcumin's anti-inflammatory effects can further weaken the body's ability to fight off infections. Similarly, the anticoagulant properties of curcumin, which can help prevent blood clots, can be harmful to individuals taking blood-thinning medications. The simultaneous use of curcumin in these medications can lead to an increased risk of bleeding. Venturing further on this journey of caution, curcumin can also be problematic for individuals with gallbladder disease. It stimulates the gallbladder to produce more bile, which in a healthy gallbladder aids in digestion. But in a diseased gallbladder, this can cause pain and potentially lead to gallstones. Now, if you're a fan of turmeric-laden curries and lattes, don't panic just yet. The concentration of curcumin in dietary turmeric is relatively low, and these risks are more relevant to high-dose curcumin supplements. However, even dietary turmeric can be a concern for individuals prone to kidney stones. Turmeric is high in soluble oxalates, which can bind with calcium to form insoluble calcium oxalate, a common component of kidney stones. So while turmeric can be a potent medicinal tool, it's crucial to understand that it's not without its potential dangers. The key, as with many things, lies in understanding your own body and its unique needs, and in the wise words of Paracelsus, the dose makes the poison. Let's examine a few health conditions where turmeric intake could be more harmful than beneficial. First up is gallbladder disease. Turmeric, despite its numerous health benefits, can worsen gallbladder problems. Here's why. Turmeric contains curcumin, a compound that stimulates the gallbladder to produce more bile. In a healthy gallbladder, this isn't an issue. However, if you have gallstones or any form of gallbladder disease, this increased bile production can cause severe abdominal pain and other complications. Next, let's talk about kidney stones. Turmeric is high in oxalates, the compounds that form crystals in the urine, leading to kidney stones. For individuals prone to kidney stones, a high intake of turmeric can increase the risk of stone formation. So, despite its anti-inflammatory and antioxidant properties, turmeric might not be the best choice for those battling kidney stones. Last but not least, we have bleeding disorders. Turmeric acts as a natural anticoagulant, meaning it prevents blood clots. While this can be beneficial for some, for those with bleeding disorders or people who are on blood-thinning medications, it could pose a serious risk. The anticoagulant properties of turmeric could amplify the effects of these medications, leading to excessive bleeding. It's also worth mentioning that turmeric can interact negatively with a range of medications. For instance, it can increase the risk of low blood sugar in people taking diabetes drugs, and it can interfere with the efficacy of anti-inflammatory and chemotherapy drugs. So, if you're on any medication, it's important to consult with your healthcare provider before incorporating turmeric into your diet. In a nutshell, while turmeric is a superfood with a multitude of health benefits, it's not for everyone. It can exacerbate certain health conditions and interact negatively with various medications. So, if you or someone you know has these health conditions, it's important to be aware of the potential dangers of turmeric. So, where does this leave us with turmeric? We've journeyed through the misunderstood magic of turmeric, dived into the science behind its harmful effects, and opened up about the dangers it poses for certain health conditions. Now, let's tie all these threads together and see what we can take away from this. Turmeric, a golden spice with a centuries-long history in traditional medicine, is loved by many for its anti-inflammatory, antioxidant, and potential cancer-fighting properties. But as we've learned today, it isn't a one-size-fits-all solution. For some of us, this spice could be more of a bane than a boon. If you suffer from gallbladder disease, for instance, turmeric could potentially exacerbate your condition. The spice stimulates the gallbladder to produce more bile, which could lead to complications if you have gallstones or a blocked bile duct. For those with a bleeding disorder or who are on blood thinners, turmeric can be equally risky. Its blood-thinning properties could interfere with your medication, potentially leading to bruising, bleeding, or even more serious consequences. And let's not forget about those with kidney stones. Turmeric is high in oxalates, which can bind with calcium to form kidney stones. If you're prone to this condition, consuming turmeric could increase your risk. But it's not just about the potential dangers. It's about understanding that while turmeric has many health benefits, it's not universally beneficial. It's crucial to consider your own health condition, your current medications, and even your genetic makeup before incorporating turmeric into your diet or supplement regimen. Remember that natural doesn't always mean safe, and beneficial for some doesn't always mean beneficial for all. This is why it's so important to be informed, to ask questions, to do your research, and most importantly, to consult with your healthcare provider before making any changes to your health regimen. After all, they know your health history, they understand the complexities of different substances and how they interact, and they can guide you in making the best decisions for your health. So before you reach for that turmeric supplement or sprinkle an extra helping of this vibrant spice into your curry, pause for a moment. Consider what you've learned today. Reflect on whether turmeric is the right choice for you. Remember, when it comes to our health, knowledge is power. Make sure you're fully informed before incorporating any new supplements into your regimen.